And open enrollment for health insurance through the Affordable Care Act is now over in all the states, but some people can still sign up for health insurance through healthcare.gov this year. Uh, who's eligible and how do they enroll? To answer that, welcome Aleka from Health Sherpa.
Thanks, Laura. Yeah, so if you are someone who's experienced a qualifying life event, you can still enroll in marketplace coverage for plan year 2023. Examples of life events that would qualify you include losing coverage you have currently through, say, a job or through another program, getting married, having any other changes in household size, having a baby, for example. It's also important to know that there are certain groups that can actually enroll year round. For example, if you make less than 150% of the federal poverty level, so that's about $20,000 for a single person, you actually can enroll any time of year using that special enrollment period. And finally, if you are a member of a federally recognized tribe, you can also enroll any time of year as well. If none of those scenarios apply to you, and again, I'd encourage you to call healthcare.gov or a navigator or a local broker to figure out if you qualify, because sometimes there are other reasons you might. But if none of those scenarios apply to you, it's always worth looking into seeing if you're eligible for Medicaid, because enrollment in Medicaid, which again is based on your monthly income, is available year round as well. So that's always worth a shot.
Thanks, Aleka. And we have a question from a senior on Medicare that looks like we'll get to that later. We have a question from Raychell that says that they need to pay $400 and some for one person to be covered with health insurance, but their income after taxes each month is about $2,700 supporting a family of four. So after rent, food, and basic bills, they don't even have the money for a single person, but yet Medicaid is saying they don't qualify either. So they can't afford to insure one person through the marketplace, let alone four of us. And it looks like their son is autistic and they have several severe health issues as well. So, Aleka, do you have some thoughts for Raychell?
I do. It sounds like your income might be too high for Medicaid, but you're being told you don't qualify for subsidies on a Affordable Care Act marketplace plan. And there are two sort of main reasons that that might happen. The first is that you're in a state that did not expand their Medicaid program to everyone who makes less than the minimum to qualify for an Affordable Care Act subsidy. That's something we call the Medicaid gap. In those instances, those states generally have an income limit for family Medicaid that is really, really low. So you could be sort of above that limit, but below the minimum you need to make to qualify for federal subsidies. That said, from what you're saying, it really sounds like you actually might be in a different situation where your income is a little bit too high for Medicaid in general, but you're being told you don't qualify for a subsidy on the marketplace. And that could be why the reason that could happen is there are a few sort of main reasons. A really common one would be if you're offered coverage through a job, for example. If you're offered coverage for a job that's considered affordable, you are not eligible for a subsidy on the marketplace. There are also a couple of other reasons. One is if you are married, you are required to file a joint tax return to qualify for subsidies. And then we also see it's common for folks to make errors on their marketplace application that are unfairly taking away the subsidy. For example, if you're applying through healthcare.gov or a partner like Health Sherpa, where I work, there's a question on the application that says, do you want to qualify for savings? Or do you want to check if you qualify for savings? It's really important to make sure you say yes to that, or it won't even check if you qualify for a subsidy. So I would really make sure that you're ruling out some of those common issues. You can call healthcare.gov. They're available 24/7. You can call a partner like Health Sherpa, work with a local navigator or broker to just make sure you're not running into one of those roadblocks that's sort of unfairly taking away your subsidy.
Thanks. Our next question is from Sheridan, who says that their neighbors need help. Both are in their 80s. He just had a hip replacement and his wife has Alzheimer's. Are they eligible for in house help? Diane?
It's a really good question, and the answer is maybe. With Medicare, you can sometimes get home health care, and you qualify for home health care if you have difficulty leaving home on your own. And it has to be serious difficulty, that leaving home is almost impossible for you to do on your own. And if you need either skilled therapy or skilled nursing services on, an intermittent basis, not all the time, on and off. And if you need either of those two services, then Medicare will pay not only for those services at home, but also for a home health aide that can assist you, usually 3 days a week for up to 4 hours a day, sometimes more, often less, depends on the home health agency that you use. But for this service, what I would advise is that you go to your primary care doctor and see if your doctor would reach out, if you qualify, to a Medicare certified home health agency to see if they would take you as a patient. Another option would be to get rehab services or therapy services directly through Medicare Part B. And Medicare does pay for therapy services at people's homes if you can find a therapist who will come to your home. Or sometimes it's as an outpatient, or it's at what's called a comprehensive outpatient rehabilitation facility. So there are different ways that Medicare will cover physical therapy under Medicare Part B, and that is another way that you may be able to get in-home services. Neither one is a guarantee. Unfortunately, Medicare should do a much better job on that front. The other thing you might do is talk to your local hospital, because sometimes hospitals are providing care to people in their homes. Hospitals have moved from keeping people in the hospital, at least some of them have, to moving the hospital, quote unquote, to people's homes. So that is another option for you that I would pursue. Lastly, I'd suggest you contact your local area agency on aging, and you can look that up online. But sometimes your community will offer these services, and your local area agency on aging provides free guidance to help you see what services are available in the community.
Thanks, Diane. And our next question came in via text. This person wants to know, will Medicaid pay for COVID vaccines after May 11th, which is the end of the public health emergency? So, Aleka, will this person, will Medicaid pay for COVID vaccines? And also, how does insurance through the Affordable Care Act, how is it affected by the end of the health emergency?
Great question. And actually, for all kinds of insurance coverage, it's kind of the same. How this actually works is that COVID vaccine availability and for free is not actually determined by the public health emergency. It's determined by the federal supply of vaccines. So as long as the supply of vaccines that the federal government has purchased is still available, you should be able to continue getting them, sort of no matter which provider you go to. That said, at some point that's going to run out. And at that point, regardless of what kind of insurance you're in, most insurance should still cover vaccines as a sort of required benefit. That said, you might not be able to go to any provider. You're going to have to go to someone who's in network with your specific insurance plan. And if you're uninsured, that's when things could get, particularly difficult for folks.
Mm-hmm. And Diane, so does that mean if somebody's on Medicare, they should still be able to get COVID vaccines after May with no problem?
Good question. And yes, the answer is people with Medicare should have no problem getting vaccines for COVID. And in fact, I was just reading that 6 in 10 people with Medicare haven't gotten the bivalent vaccine. And the death rate among people with Medicare from COVID is super high. It's like 90% of all deaths are for people over 75 with Medicare. So it's really important for folks now and as soon as possible, if not now, to get that vaccine. The thing that will change after the public health emergency ends is availability of covered Paxlovid and other COVID treatments. And as Aleka said, with Paxlovid, it will be just when the supply of Paxlovid that the government bought runs out, which will be sometime in the summer or early fall. With other treatments like monoclonal antibodies that actually aren't currently treating this COVID, we'll have to wait for Medicare to say what's being covered. But as a general rule, if it's reasonable and necessary care, Medicare will pay for it, but there will be out-of-pocket costs that will come with those treatments once the public health emergency is over.
Thanks, Diane. And now I'm pleased to introduce our special guest for today, Anne from Protect Our Care, who will be talking about the State of the Union and President Biden's healthcare agenda. Welcome, Anne.
Hi, everyone. Thank you so much for having me, Laura. I'm very excited today to talk about the State of the Union. So these speeches feels like are running longer and longer. So, if you missed it, here's the little recap of what the president said. And, State of the Unions are a time for the president to reflect on the year and everything that's happened, and then put forward his agenda for the upcoming year. So that's what we saw. And it was a big year for healthcare, and a very exciting year for healthcare. And, moving forward, it might look a little different. I don't know if we'll take quite the huge leaps forward we did in healthcare as we did in this past year, but there's still a lot to be looking forward to and to be fighting for this year. But really, President Biden has shown us what it means to be a healthcare president over these past 2 years. And thankfully, he delivered some really big items in the Inflation Reduction Act that will that are expanding affordable coverage, lowering prescription drug prices, and strengthening access to care. And these achievements have made a world of a difference for our nation's seniors, for people of color, people with disabilities, rural communities, and countless others. So just some of the things that he talked about, I would say, a lot of the looking back, you may have heard him say this in the speech over and over again. He said, let's finish the job. So he was calling on Congress to finish the job. So definitely a lot of the areas in healthcare, he was touting his record, but they were also areas where he wants us to finish the job. He called on Congress to expand those things to more people or make them permanent. So one of the things that was really important this year that the president would like us to expand is about healthcare premiums. So really exciting news is that a record-setting 16 million people signed up for ACA coverage this year, and the national uninsured rate is actually at an all-time low, and so that is thanks to President Biden and Democrats in Congress in their work to lower premiums for ACA coverage by an average of $800 per person per year. So along with this enhanced premium subsidies, the president also, expanded the Navigator program and increased outreach to make sure that people in communities were reached out to and that they were understanding that they could get affordable coverage. So thanks to all of that, people got the coverage that they needed. And they also closed something called the family glitch loophole that actually we were just talking about a little bit, that blocked many children and spouses from affordable coverage. So the president called on Congress to make sure that these savings would be made permanent. So the Inflation Reduction Act only extended them for a time, and he is calling on Congress to make them permanent so that healthcare can be a right and not a privilege. So that's one thing that we'll be fighting for this year. And then also another thing that the president talks about is how 60 million Medicare beneficiaries will be protected from skyrocketing drug costs. This was a really exciting year where Democrats took on Big Pharma and they won, which is a rare occurrence. And thanks to the new prescription drug law, Medicare will be able to negotiate drug prices and cap out-of-pocket pharmacy costs at $2,000 per year under Medicare Part D, and drug companies will be able to pay rebates to Medicare if they hike prices faster than the rate of inflation. And so those are some of the things that, that will be coming in down the pike. We're already seeing the inflation, the inflation provision take place, but really, people on Medicare are already seeing the benefits of the Inflation Reduction Act that was passed last year. Seniors across the country are able to now have their insulin prices capped at $35 per month if they're on Medicare. So starting this year, Medicare beneficiaries will be able to pay no more than $35 per month per insulin prescription. And another exciting thing that's happening is that there's no cost vaccines through Medicare. So things like shingles, which used to cost seniors up to hundreds of dollars, they can now get those really important vaccinations at no cost. So those are some really exciting things that that seniors are already seeing the benefit of. And then, 1 million surprise medical bills will be prevented every month. So before President Biden took office, millions of people received surprise bills for out-of-network care, costing them hundreds or thousands of dollars. So the administration is protecting millions of consumers from surprise medical bills through the implementation of the No Surprises Act, which has already protected 10 million Americans from unfair, undeserved out-of-network charges. We're also seeing $3,000 in savings on hearing aids. Over-the-counter hearing aids hit the shelves following a rule from the Food and Drug Administration. And then finally, one thing that the president talked about was that 39 states in the District of Columbia have expanded Medicaid coverage. And many states have it, are considering expanding Medicaid. But there are these holdout states who have not, and that has left people in the coverage gap, which was actually discussed previously by previous speakers. So, the president was calling on Congress to finally finish the job on this. So we'll be working a lot on that to ensure that, if these states who may have governors or state legislatures that are not expanding Medicaid coverage to their residents, that something's done to provide a fix. And that's something we were hoping that would be, put into the bill last year. It did not work out. So it's something we need to finish the job on. So we'll be fighting for that. And then finally, I want to say that you may have seen that some of the coverage after the State of the Union, there's been a lot of back and forth because the president, highlighted Republican tax on Social Security, Medicare, and Medicaid. After the State of the Union, he also traveled to Florida to discuss the administration's work to lower and strengthen healthcare for seniors. And at that event, he took some shots at Republicans like Ron DeSantis and Rick Scott for blocking Medicaid expansion in Florida, and threatening to put Social Security, Medicare, Medicaid on the chopping block every 5 years, which is Rick Scott's plan. So there's been a little bit of back and forth there. The Republicans are trying to hit back and say these things aren't true, but really we have Republicans on the record about destroying these programs for years and years and years. There's a lot of information on tape about how they're looking to do these things. So one senator that came out and was quick to deny the Republican attacks on these programs was Senator Mike Lee. Then shortly after, a video surfaced of him saying, before he said it would be my objective to phase out Social Security, to pull it out by the roots and get rid of it. Medicare and Medicaid are the same sort and need to be pulled out. And then we also saw a doubling down from Senator Ron Johnson, who also said it was commitment. He called Social Security a Ponzi scheme. So, the recent coverage has shown that Republicans have long tried to dismantle these programs. And so we really have to pay attention to this fight. And, they're trying to walk it back, but history has shown that it has long been their agenda to cut them. So, these are vital programs that help so many people and are just a lifeline. And so it's encouraging to see that President Biden has taken that on and called them out, because we're in a slightly different position now this year than last year, where there's a divided Congress. So it would be a little bit harder to pass things, but I think we can also come together and protect some of these programs, finish the job on some of these issues. Making sure the Medicaid coverage gap is closed, strengthening Medicaid for moms and for kids. And, especially as the public health emergency is winding down, I think it's really important that we make sure that people have the coverage that they need through the Affordable Care Act, through Medicaid. So a lot to be looking forward to this year. And hopefully we can build on the success that we've seen the first 2 years of the Biden administration.
Thank you, Anne. So when President Biden was talking about his healthcare agenda, he mentioned making the Affordable Care Act health insurance subsidies permanent, because right now they expire after 2025, to keep health insurance affordable. He talked about filling the Medicaid gap so that low-income working families in states like Florida, Texas, North Carolina, Georgia, Wisconsin can finally get affordable health insurance through Medicaid. And he also talked about insulin prices and lowering those for everyone. Right, Anne?
Yes. So right now, we were hoping to get into the Inflation Reduction Act that lower insulin prices would apply to everyone. Right now, it only applies to people on Medicare, but there were many bills in place, some bipartisan, that were kind of working through the system last year, that were different ways that we can make insulin more affordable. Of course, this is a hugely important issue. Insulin is like water to people who have diabetes. It's just absolutely vital for their health and for their lives. And so as the president often mentions, how insulin is shot up in price over the years, and even though the formulas haven't really changed, so people are just taking advantage of people who have diabetes, who need these life-saving drugs. So that is definitely one area that we definitely want to see, that whether or not it's like a $35 cap, like there is now for folks who are on Medicare, or some other mechanism to make sure that insulin is affordable for everybody. That's definitely something that the president wants to see extended this year, and we'll be fighting for.
Thank you, Anne. And thank you, everybody who joined us for CareTalk. Please keep calling and texting in your questions, and we'll answer them in future episodes. And also, if you prefer getting your health information through podcast, CareTalk is also available as a podcast released on Tuesdays. So thanks again for joining us. And this is CareTalk.